Welcome, everyone. We'll get started in one moment.
I guess not.
Welcome, everyone, to Leadership for Health Workforce Resilience, Facing Conflict, Climate, and Health Emergencies Head-On. My name is Crystal Lander, and I am the Executive Vice President with Pathfinder International, a global health and development organization working around the world to ensure that women have access to healthcare in the communities where they live. I'm also the proud chair of the Frontline Health Workers Coalition, a global network of private sector, public NGOs, and partners around the world working for the full cadre of health workers. It is my pleasure today to moderate this session on facing conflict, climate, and health emergencies head-on. A few housekeeping items for you. This session will be held in English and in Arabic. We have the honor to have a community health worker from South Sudan who's on the line with us. Please make sure you choose English or Arabic as your interpretation channel now. And for some of you, it may be the three dots at the bottom of your screen. Some, it may be a globe. We're here today because health systems are being pushed to the brink by multiple crises. Between climate, conflict, and pandemics, we know our health workers are on the front lines to ensure that everyone has access to quality health care. All cadres of health workers are facing a triple burden. One, they have to deliver on the package of care services. Two, they must respond to their own crises. And three, they must care for their own households. Our discussion will focus on two key aspects. One, we'll hear lessons from people in the countries impacted by climate, health emergencies, or climate-induced events by their governments or for things that they prepare for themselves so that we can talk about what those emergencies or planning for those future emergencies. And two, we'll identify tools and best practices to make health systems more resilient and allow for more frontline health workers to champion healthcare no matter where they are. Our panel will describe some actions taken to build the resilience of health workers and the critical leadership needed in order to move these things forward. But first, we are honored to have introductory remarks by, we'll have introductory remarks by Lisa Goodwin, who's the Deputy Office Director for the Bureau of Population and Reproductive Health at USAID. Lisa's bio will be put into the chat so you can see her full bio, but at this time, we are so happy to have Lisa join us to provide us some context on what this looks like in real life. Lisa, over to you.
Thank you so much. And good morning and afternoon and evening to everyone. And as Crystal said, I am the Deputy Director for the Office of Population and Reproductive Health at USAID Washington right now. But in my previous life, I was a family nurse practitioner. And in that role, I had been privileged to provide care to underserved populations, both in the United States and in Africa, several countries. And I can say wholeheartedly, with so much respect and admiration of my many amazing colleagues in those settings, that healthcare workers, doctors, nurses, midwives, and community health workers are the backbone of the health system. We'll hear today from healthcare workers who strive to provide essential care to their patients and their communities in the face of tremendous challenges. Health needs do not pause for crisis situations. In fact, they become more urgent. Frontline healthcare workers impacted by the crisis themselves are expected to respond to physical trauma as well as increased anxiety and mental health concerns. During emergencies, women and girls are at particular risk of harm when social and structural support systems around them collapse. Access to skilled health care workers is critical to prevent unintended pregnancies, minimize maternal and neonatal mortality and morbidity, and provide care for those harmed by sexual violence. So how is USAID supporting health workers to deliver primary health care in the face of crises? USAID leadership has been vital to ensuring access to healthcare in the face of diverse crises across the world, and USAID is investing in local leadership and resilience as global crises and needs proliferate. Prevention, preparedness, and resiliency are increasingly recognized as crucial to equipping communities to avoid crises, endure their effects, and get on the path to recovery more quickly. USAID is redoubling efforts to support primary health care as the key to detecting health outbreaks and meeting the needs of communities during weather emergencies. Primary health care can provide 90% of health services a person will need throughout their life and is an important foundation for USAID's global health investments. We call this primary impact. Through USAID's Primary Impact Initiative, countries are addressing the inclusion of local health actors, including health workers and civil society, measuring and learning to ensure activities reflect best practices for delivering effective primary health care, and expanding coordination with other global development partners. USAID is also reaffirming its commitment to family planning as a key part of primary health care, helping millions of people choose the number, timing, and spacing of their pregnancies. This has resulted in significant social, economic, and health gains. USAID supported projects such as Propel Adapt and others help advance USAID's Primary Impact Initiative through their support of community health workers. It is critical to engage healthcare workers, including community health workers, in these efforts to develop leadership and reform policies that prioritize health workers. This is also a gender equality issue. 70% of the global health workforce are women, but their contributions too often go undervalued and underrecognized. Community health workers, the majority of whom are women, deliver essential health care to more than 1 billion people, but are rarely included in policy development or in preparedness planning ahead of disasters. In response, Propel Adapt recently developed a curriculum to strengthen women's leadership to engage in climate resilience policies that recognize and prioritize gender to ensure continuity of family planning and reproductive health services. Propel Adapt is also working on a toolkit to assist community health workers to champion primary health care access during crises and facilitate their participation in local disaster planning. Today's webinar provides an opportunity to hear directly from healthcare workers about how they demonstrate leadership in the face of challenges to care for their patients and communities. I appreciate the opportunity to commit my own leadership as a nurse practitioner and a representative of USAID to support other health workers around the world. Community health workers, nurses, midwives, and doctors have incredible lessons to share about how they navigate overlapping challenges to deliver care. I look forward to hearing from today's panelists and continue to partner and empower healthcare workers to deliver on our shared priorities to improve the health and resilience of communities. It is a privilege to be with you and hear about this today. And with that, back over to you, Crystal.
Thank you, Lisa. And wow, I'm just excited with everything you said. You set the stage, and so what better with a health worker in front of us right here to kick us off. So I am Lisa will be joining us for this panel, and I will introduce the additional panelists joining us. Viviana Nag Nendaga Maldul, who's a community health worker in Boma Health Initiative in South Sudan. We have Dr. Janet Maraku, Senior Director of Health Workforce Development in Kenya, Country Director for Intra Health. And then we have Dr. Michael Abuta, who's a Program Manager at Project Hope in Gaza. So again, their full bios are in the chat, and we're going to jump right in. Viviana, I'm going to start with you. In South Sudan, climate change is linked to increased flooding, droughts, and high temperatures. How has this impacted the community from a health perspective? Viviana, you're on mute if you are speaking.
Yes, is Viviana is going to speak in Arabic. I don't know if they can read the question in Arabic for her.
Do you want to hear the question again?
It's supposed to be translated in Arabic for us to be able to get. We are not getting the translation.
Okay. Mohammed, could you help her? Okay, he's translating for you now. Sure, of course. In South Sudan, climate change has been linked to increased flooding, droughts, and high temperatures. How has this impacted the community from a health perspective?
ما في ترجمة.
He's not hearing anything?
ما في أي ترجمة بالإنجليزي بس.
English? Hello?
Yes. Can you hear us okay?
Hello? Is there anyone speaking in Arabic for her?
Yes, Mohammed will be. Why don't we come back and we'll work on your
I think they're not in the right room.
I don't think they're in the right channel.
Yeah.
So why don't we, I mean, she's not in the right channel. Okay, she may not be in the right channel. We'll work on that offline and we'll come back to Viviana.
Okay.
Dr. Janet, let's go over to you. How do we develop and retain health workforce resilience for climate, conflict, and health emergencies?
Yes, good morning, good evening to all. Thank you, Crystal, for that question. And yes, you have brought it, I mean, the question is quite pertinent to what we are seeing today as a burden to our health workers. Really, for me, when I look at climate-linked crises such as the floods, the heat waves, the disease outbreaks, we really need to ensure that our health workforce is prepared, it is responsive, and is able to recover, because I think recovery is also important after all this crisis. And this really calls for multi-sectorial approach, education, infrastructure, transport, and health itself. You have also to incorporate even the local administration when you're responding to climate-related crisis, as well as the community. And to ensure that the health worker is prepared, we really need to look into exploring into, are they put in a system mindset towards a multidisciplinary team approach? And it's the multidisciplinary teams will play out whether it's health or non-health. So that really is important in developing our workforce. It also requires that we look, therefore, at their pre-service education. Is the curriculum prepared for them? Are the academic institution, the medical training universities and colleges, are the faculty able to ensure that that integration of health, climate, and disaster management is included? During that pre-service education, are these students undergoing simulation training on how to prepare for conflict, how to prepare in case of floods, how to prepare, like in the case of another attack of COVID-19 or touch wood, another disease? Is that simulation happening? When they go out to the labor market while they're working at the health facilities, is in-service training also being provided? Are they getting refresher courses? That's how we really develop our workforce to be able to be climate resilient, because we do need that climate resilient workforce. Funding is also important, because in times of conflict, in times of these floods or extremes of temperature, we really need to look into the working condition of the workforce. If it's in temperature extremes, is the infrastructure facilitated for air conditioning, that the health facility, therefore, the health workers are able to work in a comfortable environment and also attend to the patients? During floods, do we have an opportunity for even a mobile or a facility where services could be provided we have seen in instances in Kenya during the last floods we had early this year during our long season, some health facilities actually were submerged in water and they could not therefore be operationalized. So do we have a fallback plan? And this could be in the relocation camps that are on higher grounds. Do we have a resemblance of even a tent or a mobile truck that could be used for the delivery of health services?
Yeah.
The other
This
thing
is
is
this Okay, let me pause you here because I want to make sure we come back to some of these themes you talked about. You really started with like preparing. We got to prepare, we got to train, we have to bring people in. And then, but you started with, when you started talking about the floods earlier in Kenya, the first thing I remember seeing and thinking about is the safety. And when we think about safety, we think physical safety, but health workers live in that community too. How are we preparing and supporting them? So I want to go over to Dr. Mafuel and talk about what are the standards and protocols used to ensure that safety of health workers with that delivery, because that could be flooding, that could be direct conflict. What are you seeing there? You're in Gaza, you have everything happening at the same time. Can you talk a little bit about that for us?
Yeah, thank you, Crystal. First, Gaza has the most challenging humanitarian context in the whole world. So the situation is very, very, very dynamic. In a minute, the things will change. So following up the safety or ensuring the safety of it requires a lot of things. One of the things that we are doing here in Gaza, actually, first, it is the security protocols and coordination, either on the health facility level or at the community. On the health facility level, we have the deconfliction for all the health facilities that ensures the safety of all of our health workers. That is first. From the community, all of our community health workers their movements are being notified. So that's a little bit mitigates the risk and ensures safety. Also, we have our own SOPs in adherent with the international guidelines for OCHA, UNDSS, a little bit contextualized to the Gaza context. And the other thing is that for each health facility, we do some kind of risk assessment for each one. That is from a security perspective. From a medical intervention, we have the IBC measures. Tamam. The thing that is with the IBC measures is that the resources are a little bit, not a little bit, are very much scarce, including the hygiene gels, the gloves, the masks. So we are doing some kind of, it's a little bit challenging, but we are doing the minimal thing of the infection and prevention control for the health workers, also for the patient, but also for the health workers to prevent themselves. Because as you know, there was two main outbreaks here in Gaza. We have the polio virus and then the multiple dermatological diseases like scabies and impetigo. So that is the second. So from a mental health perspective, I myself have been done multiple psychosocial support sessions with our psychosocial officers. I was working in a hospital. I witnessed a lot of stuff. Our social workers here doing a lot of stress management sessions, are doing a lot of hard work and support to support us. And when the hard time comes in terms of there was reports for an attacks of the health facilities and destroying the infrastructure. So in these kind of things, we do through the cluster and the international organizations here, we do some kind of high-level advocacy campaigns that supports these kind of things. over.
Thanks. This is super helpful, and I'll definitely have some follow-up questions. Lisa, I'm going to come over to you. As the largest donor to global health in the world, USAID's role is really important, and you set the tone for so much. And I love that you talked about the role of women and how important that is to this conversation. I wondered how and this is ever growing, right? So climate and health going together. I love that global health is taking on climate. We didn't used to see that. But how does it play out across the agency of global health? Like, how do we ensure that it's still working? There is no budget allocation for climate. So how are we expanding and making the most of these funds to make sure we do what you know as experts we need to be doing?
Thank you, Crystal. And you really touched on the challenge that it is to program for climate across the Global Health Bureau. And so we are looking for opportunities within our programming, as you said, across, infectious disease, maternal child health, the population and reproductive health, and HIV. We have the Office of HIV and AIDS. And we're trying to build it into our programs and make it an integrated approach because we do actually have a couple of standalone climate awards that are happening, but we're having sort of limited, or we're kind of like building the plane as we fly to figure out the best way forward to do that. But what we find is more sustainable is building it within the programs that we already have, addressing the issues at the ground level when the partners are working with our people out in our countries. And we also are finding that missions themselves, and by that I mean the countries where we work, they obviously have a much better idea of what's going to work in their own setting. And so we are, learning and bringing everyone to the table as much as possible because that's the best way to move forward in that area.
I
Over.
love it. And it goes to what we are talking about here is who better to talk about this but health workers who are on the front lines and say what this has looked like, which leads us right to Viviana. I think you're back with us. Can you hear me okay?
Yes, we are hearing you.
Wonderful. So Viviana, I
Yes.
wanted to come to you. Thank you for joining us from South Sudan. Could you talk a little bit about what you're seeing there regarding climate change and increased floodings and droughts and the high temperatures? And how is that affecting the community from a health perspective?
Hello. We would like this translated into Arabic. Viviana doesn't know Arabic. I mean English. She can't understand English very well.
Okay. So I think that we were asking you to go to the globe at the bottom of your screen and you click on it, and then the Arabic interpreter is on the line for you. Well, and for her. Sorry.
To the global.
Yeah, it should be a globe or three dots at the bottom of your screen. And then with that, you click on it and it should say Arabic. Are you hearing the interpreter in Arabic now? You're on mute. You're on mute.
Yes, I can see that there is interpretation, but I'm not seeing. We cannot hear the Arabic.
Yeah, so if you click on Arabic, and you start talking, he will talk in your ear in Arabic.
Ah,
Do you hear him?
I already clicked on
Okay.
it.
Okay, I think he's ready now. They got it going. Thank you everyone for your patience. We definitely want to get Viviana's voice in here. So I'm going to repeat the question again for the interpreter to give it to Viviana. Viviana, we just wanted to hear your perspective from South Sudan. How has all of the climate change in your community impacted the community from a health perspective?
اوكي. في جنوب السودان في خيارات هائلة وجفاف وارتفاع درجة الحرارة. أما الفيضانات له تأثير سلبي في اتجاه الصحة. عند وجود فيضانات يرتحل المجتمع من مكان إلى مكان آخر يبحثون عن الملجأ، وذلك يسبب مم، ذلك يسبب كما قسمه أنس.
Can you talk a little louder for us?
أوكي. أوكي، الفيضان يؤثر. هل تسمعني؟ مم؟ أوكي. أوكي، إلى الفيضان تأثير هائل في مجال الصحة. إذا يوجد فيضان في مكان ما في جنوب السودان، يقوم المجتمع إلى الانطلاق من مكان إلى مكان آخر، وذلك يسبب تضخم سكاني، أو يؤثر في جانب الصحة. التضخم السكاني ذلك يظاهر في الأمراض مثل الملاريا، الإسهالات، والتايفود. Are you hearing me؟ لا تسمعني؟ هلو؟ بوضوح. تقدر اسمع؟ هل تسمعني بوضوح؟ أوكي، وذلك بسبب الكثافة السكانية. أما الكثافة السكانية يؤثر بجانب الصحة. مم، يساعد في انتشار الأمراض مثل الملاريا، الإسهالات، والتايفود. وفي نفس الوقت يعني الطرق من التنقل من مكان إلى مكان آخر بيكون صعب، وذلك يسبب في الموت العاجل بالأخص للنساء الحوامل. وذلك كمان يؤثر كيف يعني بسبب حالات النفسية وحالة الجنون أكثر شيء. أما في جانب بتاع الجفاف فذلك يؤثر بشدة في محصول إنتاج الزراعي، وذلك يسبب تناقص غذائي وارتفاع أسعار السلع في السوق. ويساعد. سامعني؟ هلو؟ أوكي، وذلك يساعد في انتشار سوء التغذية بالأخص للأطفال الصغار. بوضوح. أما في جانب درجة الحرارة وذلك يساعد في انتشار عدة أمراض مثل شلل الأطفال مم، والهستيريا. وفي الجانب بتاع الأشخاص الكبار، بجانب الأشخاص الذين يكون لديهم الضغط، أما ضيق النفس، وذلك يؤثر معهم بصورة عامة يعني. ده في المنظور الخاص. Hello?
Thank you. Thank you so much, Viviana. It is wonderful to have your perspective here, and we really appreciate it. While I have you, I wanted to do a follow-up question. How is the role you spoke to a population, more people coming in, the flooding, all of these things I'm sure make your jobs more difficult as community health workers. How are you all changing to adapt to everything happening around you?
مم. أوكي. أوكي، يشارك العاملين الصحيين من المجتمعين في مشاركة المجتمعات آثار الصحة في تغيير المناخ. في جانب العاملين يجب عليهم إرشاد المجتمع أو توعية المجتمع بكيفية حماية نفسهم بأنفسهم. ويجب للعاملين المجتمعين الصحيين برابط الوضع الصحة العامة وإبلاغ الجهات اللازمة عند حضور أي حالة أو حالة طارئة أو حالة غريبة. يعني في حالة أزمة المياه يجب عليكم إرشاد المنظمة التي يساعد المجتمع في حضور المياه. منظور الخاص. Hello? Mm,
And I'm sure
yes,
making your
okay.
job, of course, far more difficult. So again, we are grateful that you're able to join us and thank you for your hard work. Janet, I want to come back to you. What are some of the approaches you all are using to address? You were talking about the flooding and all the things going on and some of the training that you're doing. What additional approaches are you're doing to plan again for the future that unfortunately this is where things are going and we have to adapt. So what are some of the other things that you're doing there in Kenya?
Yes, thank you very much, Crystal, for that question. I think for us, what has been critical in collaboration of our work with Ministry of Health and the county governments is to put climate change and health as a priority. So the Ministry of Health has put in place policies, and within these policies is the prioritization of that nexus between climate issues and also those that are disaster and conflict issues. That becomes important. Second to that is contingency plans being put in place. This becomes one of the response mechanisms for health facilities to continue providing services to the communities that are now vulnerable. So ensuring that those contingency plans are operationalized. The teams have also been able on the ground to do simulations, and therefore they are ready when those crises are happening. Working with other sectors, both health and non-health, the ministry and the county governments have also put in the early warning indicators. And these are essential to ensure that if, for example, high rainfall that will contribute to floods is foreseen, are the communities aware that this is happening? Are the health managers on the ground also that this is going to happen? Have they considered the higher grounds in which they will evacuate from? So those early warning indicators are important, and the conversation and the awareness to all community and health workers also becomes critical. The other really also to ensure continuity of services is the preparedness of the service provision itself and the recovery plans, which are within the contingency plans. That also helps in framing the agenda, the resource mobilization, both domestically and also from any partners who may be on the ground that are also supporting humanitarian efforts. Thank you.
No, that's super helpful. We talked about, Lisa talked about primary health care. These clinics, you spend a lot of time getting people to identify, get to the clinics, get to these resources, and then they could be taken out with one big flood. And then you've built all this demand. And so it's really important that awareness and that prevention and that early warning system they're so important. But I love the idea of working with the government to say, we have to alert people. People may not know, so you have to talk about it and make sure it goes beyond health. Super helpful. Dr. Marquel, again, you talked about the difficulty of working in a place like Gaza, but we unfortunately know that it's just one of the many places around the world that's experiencing a lot of conflict. Can you give some like tools or maybe best practices for some of us who are supporting programs in other countries or working in countries where they are having conflicts? Like, what are some of the things that you say, without a doubt, we need to make sure we have in place to support our health workers?
Yeah.
Okay.
Sorry for that. So one of the big things, and it was very, very, very helpful. It was our engagement with the clusters. Okay, either the health cluster with its various working group, either SRH working group, health service delivery, trauma working group. Also, uh, those are like on the different sectors: health, wash, and protection, because in Gaza context, those are the main gap areas. If we can address those, more than 80% of the health needs will be covered. Tamam? So first, our engagement with the health cluster. The most challenging here in Gaza is the supply chain interruption. We have a lot of supply chain interruptions. Only 33 truck uh, being delivered into Gaza for all the sectors, for the health, for the wash, for everything. So that is, yeah, it is very, very, very low. It does not meet any demands. So in terms of us, we have the other partners also supporting each other so that the aid won't stop for the people. And health workers, without these supplies and without these resources, they can't work. So engaging together, making these supplies and these resources available, strengthen the workforce, the health workforce, for them to help the community. Tamam? That is a very strong point. The other point is that on the job training, either by two levels, we sometimes do capacity building for those health work force, and we do through the EMTCC also, we bring many, many internationals for those health workers to build in their capacity. تمام؟ يعني they are facing a lot of challenges, but at the same time, they are building their own capacity. تمام? That's the second point. The third point is that, which is an important here in Gaza, is that the health workers themselves are having challenges. They are being they have their family needs, they have their own needs. There are multiple evacuation orders being done. They are displacing from area to area. So we are supporting them either by providing them a place to reside, either providing them a good environment for them to work. Sometimes by by offering them a job, a difference. It might be silly, but offering those people a job, it would make a big difference for the community, for the health workers themselves and their family. The fourth point that I'm going to talk about, it is one of the best practices in Gaza, which was not before the war or before the conflict. It was not emphasized, which is the mobile medical units, MMUs. Before the conflict, this MMU or this practice was not known here in Gaza, but in this time of conflict, we did implement those MMUs for the places that are not accessible, and it made a very big difference in the health service delivery. Over.
Thanks so much. And you said so much. I think it just reminds us of how important the work is, and remind us how health workers are people who still have to live their own lives in all of this work. So we're just going to do a final round of the one question, all of you, on basically what's the one thing you want everyone on this call to take away. And I just want to remind our colleagues, Viviana, we're going to come to you last, but remind our colleagues who do not speak Arabic to remember to go to the English channel. So again, it should be either three dots to click on English, or it's right at the bottom, a globe for you to click on English interpretation. That way you hear the interpreter in your ear who will translate the Arabic to English. So we'll give you time to do that as we go around. I'm going to kick off with Lisa for this last round. What's one thing you want this audience to take away from this session?
Thanks, Crystal. What I'd like the audience to take away from this session is that we have to reach out to each other to look for solutions. None of us live in a vacuum. We live in the context of a globe where we can be affected by crises at any time, in any country. No country is exempt from this. And we represent a group of people who have ideas that we need to share those with each other to look for creative ways to solve these issues. Over.
Great. Yes. Even living here in the United States in Washington, D.C. area, over where I live, flooding happens the same way. And it is, you feel lucky to have the resources in place, but you recognize how quickly what this can look like when you don't. So yeah, it's a good reminder. We're all in this together. Janet, what's the thing we should all take away?
Yeah, thanks, Crystal. I think for me, the most important thing is that climate resilient workforce is an investment. We must prioritize it as government, non-state actors. We have to prioritize it. So it's not going to just happen. We must make it routine, which begins with how we prepare them in terms of the in-service training and the pre-service training. We also need to look at innovative approaches. This is learning on the go at times, as has already been mentioned by another speaker on the panel. We have to introduce digital learning, that is e-learning platforms. We have to do the mentorship. And we also have to think about the surge team that can be easily mobilized to support the crisis as it's happening on the ground. So for policymakers, please invest in building the resilience of our workforce for conflict and climate crisis. Thank you.
Great points. I love it. Innovation surge teams. We hadn't heard that yet. So great. McQuell, what's the thing you want everyone to take away from this session?
The thing that I want you to take away with you is that me before being a manager, I was a first responder. Tamam. I used to go on the ground on the field, but after like the program has improved, we are managing. But I have this thought, and it is a fact indeed, is that ideas comes from the ground, from those first responders. So either if it's a practice, either if it's an alternative, either if it's an engagement with the stakeholder, all of these things count. So yes, first responders and health workforce counts for everything. Over.
I love it. And Viviana, to you, what do you want us to take away from this session? Viviana, if you're speaking, you're on mute. Oh, okay.
I'm going to speak. اوكي انا اعتقد يعني المجال ده وصل مجال الانسان يعني مجال الانسان ده مسؤولية عن كلنا والهدف الاول انك تساعد المجتمع حقك مم، وفي الحقيقة يعني كثير ما قصر معانا يعني قام بوضع بالطابع الكامل هنا بنشكره شديد ونتمنى يعني يكون مواصل معنا بنفس الطريقة لأنه بيساعد في الخدمة بصورة صح ونديه الشكر الشديد. Thank you.
Thank you, and thanks for joining us again. This has been an incredible panel. We know that technology makes it gives us an opportunity to hear from people in the communities where they live. And we are grateful that Viviana is joining us from South Sudan. McQuell is joining us from Gaza. Janeth is joining us from Kenya. And Lisa is joining us right here in Washington, D.C. With technology, we're allowed to do this, but we also know technology has limitations. And so we are grateful that you all are with us and that we could have these voices and hear directly from those who are doing the work. And we appreciate it. For the rest of you, just to remind you of couple key asks that we are looking for support around is to remind us that climate is not something we could do alone. We have to address this at all levels. We heard from multiple speakers today that collaboration, we are in this together. It doesn't matter where you live, that we all have to be a part of this solution. We also heard really clearly that even in the countries where we work, they have to collaborate, and that's a big part of what we need to do to ensure that continuity. Investing in health as part of our overall national climate plans are really important and is important for donor countries as well as recipient countries. We heard that with Janet talking about how important it is for governments to prioritize it and build it, and the money will come. We have to keep advocating for it for our long-run plans. We also talked about investing capital resources in healthcare workers so that they're supported, they have the resources to do what they need to do, but also recognizing that they need to prepare for the future. The innovation is so important as they prepare for health for the future and the communities of future who need health. So we can't just think about now, but we have to think about what it's going to look like 5 years from now. Climate change is not going to get better without more investments. We hopefully can slow down things, but we know that we have to prepare and our workforce has to be prepared for that. I thank you all for joining us, to our amazing partners who joined us on this journey today. And then I think GHC, I just wanted to make sure you didn't have any final logistics before we closed out.
No, we're all good. Unless Ileana, is she still on here? If you want to say anything
No,
or add anything.
I was just trying to clap my hands. This was an amazing session. Thank you so much for your participation in the symposium. And we loved having people on the grounds come and talk to us about their experiences and what they think are important. So thanks.
And thanks to GHC for hosting this amazing conference every year. We look forward to it. It is the greatest way to bring our diverse global health community together. And thank you all for the participants who joined us today. Again, thank you to our amazing speakers, Lisa, Viviana, Markel, and Janet. Have a great rest of your conference.
Thank you, everyone.
Thanks, everyone.
Mm.